Well, welcome everybody. This is Dr. Michael Kaye from the Center for Functional Health, and I am honored to have Dr. Vinny Leonti with me today. Dr. Vinny, thank you very much for coming on and sharing with us your knowledge. We are living in some crazy times right now. Looks like and reading like it is a novel, a book of fiction, yet this is nonfiction. So I'm looking forward to hearing what you can share today. Again, our goal is to lend some calm to everybody that's out there. And at the same time, I want to hear about your backstory, how you got involved in what you're doing, and we can move forward from there. How's that sound?
Sounds great.
Excellent. So if you can give us your educational background, you're a medical doctor, where you went to school and all that.
Okay. Did my college at the University of Rochester in New York, and then medical school at Upstate Medical Center in Syracuse. Went from there, did my residency in family medicine at United Health Services in Binghamton, so all in upstate New York. And then I spent primarily my time, about 28 years in, 24 years in the emergency room, and then another 8 years doing conventional family medicine. And then launched into my current integrative and functional medicine practice about three and a half years ago now.
So going from basically, one could say, a traditional setting into this integrative model, correct?
Correct.
How was that received by your colleagues when you said, hey, listen, I'm going to kind of do this kind of work?
Yeah, I think most people were supportive, though I don't think they really understood what I was doing. So, it was, I think a lot of people just don't really understand the model. So it was just like, oh, Vinny's going off and doing something else. So
I know when I work with a neurologist, and when he had the meeting with the hospital and said he is going to leave hospital, he's not going to come in for rounds anymore, and he's going to deal just basically with chronic pain, they looked at him like he was just bonkers. How dare you, buck the system?
Right.
So I know sometimes it's very hard for you guys to say, hey, you know what, I'm going to do something that's different, but I'm sure, there's a lot of great passion behind what you do. You get to spend your time with your patients now.
Right, absolutely. And for me, maybe it was made easier because not only did I leave my former job, but I actually moved entirely out of the area because I was in upstate New York. So it was just a totally clean break, which is sometimes easier probably than what the neurologist did, where he's kind of staying in the same area, but just not going to the hospital. So,
right.
But yeah, get to spend a lot more time with patients and look at things, through a different lens, a much more powerful lens, if you will, to help create health rather than just kind of manage chronic illness.
So the typical patient that comes to you, I mean, are they seeing you as their primary care doc? Are they seeing you for, I know you have the medical marijuana program. So what is your typical patient that you see?
Not even sure that there is a typical patient.
Okay.
There's probably or maybe typical groups, if you will. There are some patients who have kind of that complex chronic illness, fibromyalgia, chronic fatigue, autoimmune diseases, that lends itself more to a functional approach rather than more of the conventional medicine. And a lot of those people have been through kind of the mill of specialists, if you will. They've seen oftentimes 3, 4, 5, 6 specialists and haven't gotten answers to their problems. So we'll get those people to work with. Then there are the people who are coming to me who maybe are somewhat more conventional in terms of they're coming to me because I have a particular passion, excitement about taking care of people with vascular risk factors, preventing heart attacks and strokes, and helping with the cardiometabolic syndromes. So those folks are a little bit more conventional, just getting the benefit of more of looking at the root cause and, waking them up to the idea that you can actually reverse your illness rather than just kind of taking a pill or moving on to insulin, that kind of thing. So there's that group. And then there's, as you mentioned, the group for medicinal marijuana. And those folks are more coming to me just because they either have problems with chronic anxiety or chronic pain. And I'm more just managing, certifying them for medicinal marijuana and helping to manage them in that fashion. Those people often have their own primary care doctors that they're still seeing, maybe even pain specialists. Folks who are either coming to me for their vascular risk factors or for their autoimmune, they may choose our practice as their primary care practice. And I would say probably get about half and half. Half of them will keep a primary care doctor, the other half will start using us as their primary care. So.
Now I want to talk about cardiovascular, but before we move on to that, my question is, have you found good outcomes using medical cannabis for those with autoimmune? I mean, the fibro patients do very well with it. Are you using that for autoimmune as well? I'm curious.
We haven't, I guess what I would say is it depends on where the patient is on that spectrum. I really haven't been targeting the autoimmune patients for that. More likely to go to low dose naltrexone and CBD first. Certainly, if they have a painful condition, as you said, with fibromyalgia and that kind of thing, I think cannabis is supremely helpful. But for actually using it to reverse autoimmune disease, I haven't really ventured out into that particular territory as of yet.
Gotcha. Okay, so we do have a question from one of our attendees, and this will be a great segue into cardiovascular. Is, do you support a low carbohydrate, high fat diet for cardio patients?
Often depends on the patient. I certainly support a lower carbohydrate diet for almost all patients. There is so much cardiometabolic disease here that, yes, certainly a low carbohydrate. And it depends on the fat. I mean, I am not limiting fat in my patients, but I certainly want those to be good fats. I want those to be the olive oils. I want those to be, nuts. I want those to be avocados. I'm not so keen if they're going out and eating steak every night. That's probably not something I'm going to support. But certainly the good fats, and an occasional, grass-fed, organic type of steak I certainly think is, for most people, is fine. But I'm not specifically looking at a specific amount of fat, but what I'm looking for is a lower carbohydrate, and seeing, those people will go more towards fat. I'm not looking for a lot of high protein either. So certainly good fats, I think, are great.
Right.
Actually.
So before we start going down the road of statins and stuff like that, why don't you share your story about your cardiovascular event that, got you moving kind of, I guess this is that event that kind of got you moved in that direction, you think, or?
Actually, it got me wondering anyway. So yeah, let me tell my story. So I was I was an ER doctor, as I mentioned. I was also, I liked exercise. I was a runner. I run 4 marathons. So I was surprised when I was out for just one of my routine 3-mile runs when I was 57 years old, and developed kind of a squeezing chest pain. Didn't really want to believe that was angina, but I noticed that when I ran, it hurt, and when I walked, it didn't hurt anymore. So I went and saw the cardiologist, had a stress test, which I gloriously flunked. Had a cardiac cath the next day, and I had an 80% blockage in one coronary artery and a 70% in another, and I woke up with 2 stents. So that was surprising to me. And really, it's taken me, even doing what I'm doing, it kind of taken me these past 7 years. I really started doing integrative and functional medicine about 3 years ago, but I still always wondered why I had, why I developed coronary artery disease. My dad had coronary artery disease. He had a heart attack at the age of 47, but he smoked Lucky Strikes. He was 60 pounds overweight. So I didn't have either of those particular risk factors. So I thought that I was going to be immune from coronary artery disease. But I did have some other risk factors, certainly with working in the ER, being on the front lines, if you will, high stress job, kind of disrupted sleep during that time period. Those were some of the risk factors I, certainly contributed. And it turns out that finally figured out that I have an inherited risk factor, a lipoprotein disorder that I must have gotten from my dad because my mom lived to 92 without heart disease. So that was not tested for by any cardiologists, only tested by my own integrative physician. So I think that put, kind of one of the final pieces in place for me. So yeah, so I became, after this, with my heart disease and realizing there was different way. I went to the Institute of Functional Medicine, took their cardiometabolic. That was my first module. And when I saw the power there, it really did make me see that there was a different way of doing things and that I could help people in a much different and much more powerful fashion than I could by using conventional medicine and conventional risk factors and that kind of thing. So
I can tell you that, I work with, I should say, cardiologists are in my area where I work, right? They're across the way. And they don't even know like this side exists from an integrative perspective whatsoever. I want to talk about lab testing, and I can tell you that simple things like when I say, hey, did you guys run an LDLP? They look at me like, why would I even do that? I'm going to give them a statin anyway. I'm like, LabCorp has this NMR profile that's incredible, but like, what a waste. We're just going to give them the statin anyway. So let's jump into, if we can, lab work, your feelings on lab work, the importance of LDLP, if you feel that's important, and statins.
Yeah, sure. So typical lab work that I do on all my vascular risk factor patients, and any patient who actually is maybe over the age of 40 that might have something inflammatory going on. I check an expanded panel of inflammatory markers that tell us about that, give us an idea whether there could be inflammation coming from the mouth, the oral microbiome, if you will. Markers that say if there is inflammation in the arteries, and checking microalbumins to see if the kidneys are starting to leak from inflammation. So we do those inflammatory markers, and then we do that, as you said, that NMR lipoprofile, which is looking at not just the standard, total cholesterol, LDL, HDL, and triglycerides, but looks at the actual particle numbers. And yes, I do think those are very important because you can have what looks like a somewhat high LDL, but when you actually look at the particle numbers, you can see that those particles are actually of a larger size, less likely to be inflammatory, less likely to damage blood vessels. And so that person, you might not rush to give a statin. You might do some lifestyle modifications and, put them on that low carbohydrate diet and see what happens with their numbers rather than just rushing to a statin. I try to avoid statins in, the majority of my patients. Do I say that I never use them? I would never say that. I think there are certain people who have high inflammatory markers. And we also do a test called CIMT, which stands for carotid intimal medial thickness, which actually lets us look at their blood vessel wall and see if there's inflammation and plaque and how much of that there is. And if there's a lot of that, and you can get an idea whether they actually might have some early event risk, as they say, that they might be more prone to have an event in the next 3 to 5 years, I might use a statin temporarily because it is very powerful at getting things down. And well, we kind of put all the lifestyle and things into play. But that is the minority of the patients. The majority of patients, I would say that I don't use statins and will use lifestyle and botanical supplements to quell inflammation, get their LDL and HDLs better, and attack it from that way, along with the lifestyle, and making sure all those microbiome to see if there's high risk bacteria in the mouth. Doing all of that. And that is much more powerful than just looking at the cholesterol and putting them on a statin, obviously.
Right. That happens as a norm.
Right.
So what does that conversation sound like if you do have that conversation of, here you're seeing your patient, it comes from maybe a cardiologist or another doc, you do run the NMR lipid profile, you do say, hey, this is kind of crazy here. Why don't we have you come off of a statin and try this lifestyle change? How is that accepted?
I'll have to say that I would say the vast majority of people who come to my office seem to be in the group that wants to come off statins.
So, okay. So there's some motivation to begin with, so it makes it a hell of a lot easier.
Yeah,
That's
absolutely.
Sure. Okay.
Yeah.
So we got another question here. Can an MI, myocardial infarction, cause lipids to change after the event? Do you think that? So can an MI cause lipids to change after an event?
I think it usually lipids changing is more a function of the diet, in my experience. I haven't noticed post MI that just the MI itself will cause it. But usually what happens after an MI is, I would say about 99.9% of people come out on a statin. So I would say certainly the statins will change the lipids. I'm not sure which way we're talking about the lipids going, if the lipids are going up, down, or down. But certainly usually after an MI, there's a statin involved, and that will usually make it lower. And certainly dietary changes can have a huge impact if people change how they're eating. And most people do after they have an MI, usually pretty motivating for people. So if there's more detail on that, I can comment on that more for sure.
So can you briefly discuss about apolipoprotein A and B?
Sure. So apolipoprotein A is an apolipoprotein that is on the HDL particle, and apolipoprotein B is on the LDL particle. And that usually gives us a better idea. It sort of correlates with particle number, if you will, because there's one apolipoprotein A on each HDL particle and one apolipoprotein B on each LDL particle. And it's the ratio of those two things that will help you determine if somebody's at higher or lower risk. The higher the ApoB in relation to the Apo A, the higher the risk is. Gotcha.
So when you put somebody in your protocol, I mean, we've seen this in our office. We rerun the blood work and we see improvement. Mm-hmm. So how many months, weeks do you like to see after you put somebody on a statin to rerun it to see how they're doing, or an integrative approach without a statin or a combo?
Yeah. So I like to recheck labs at like 3 months usually. Okay. And often that's when the insurance companies like to pay for them. So that kind of correlates pretty well.
It just so happens.
Just so happens. I mean, I think you can actually see changes in lipids. I've seen changes within a month, actually. So you can see them that quickly. I tend not to do it that frequently, just because the insurance companies don't like to pay for it. Right. So
I think the lifestyle plays such a large role, from nutrition to sleep to exercise. So I want to talk about exercise a little bit. We have these people that over-exercise, which is not healthy for them. We know that there have been articles out there with those who do long distance running marathons have AFib. So what is your take on exercise?
Yeah, so I might have been an over exerciser, right? I told you I ran 4 marathons. I did that over the course of probably a few decades anyway. It wasn't like I ran a marathon every year, but certainly I wonder if I did put my body under more physiologic stress than I should have. So yeah, I think you can over exercise. I think you can that can result in elevated cortisols and insulin resistance and that kind of thing. I go by the guide, I think the guidelines of 150 to 300 minutes of moderate intensity exercise, aerobic exercise every week, which would be considered jogging or running, certainly not, I wouldn't think that the people who are, not the elite runners who are, are in racing form, that's more high intensity exercise. But I think for most people who are moderate, moderate intensity, those, 8, 9, 10-minute miles, probably more moderate intensity. I think once you start getting down to the 6-minute, 5-minute, 4-minute miles, I think probably those are high intensity exercises.
Yeah, there's high intensity.
Yeah.
I love the jump rope. I think the jump rope is probably one of the most efficient piece of cardio equipment that one can use. And it's not like you're going to be jumping rope for like 15, 20 minutes either.
Right.
It's very efficient.
Yeah, absolutely. And so when they say 300 minutes of moderate intensity, and actually, fast walk is also in the moderate intensity. Right? So, but something like jump roping, or actually, so the running, it would actually, you usually get about double the minutes in terms of, so if you walked for say 150 minutes, running for 75 minutes would be considered somewhat equivalent to that. And jump roping, is probably is certainly more, probably gets into the higher intensity category than running, does. So doing that.
And easier on the joints too, right? So if you know how to jump rope properly, it's just so much easier on the joints. I mean, you're really preserving your ankles, your knees, your hips. So it's a wonderful movement pattern.
I'll have to have you teach me how to jump rope, Michael, because I can't seem to coordinate that for some reason.
Yeah, I mean, when I was taught that back in chiropractic college, it was like, wow, a whole world just opened up. It's like I don't have to run for 2 hours and still getting some wonderful cardio work.
Yeah.
So it's really an excellent activity.
Mm-hmm.
So before we get on to the current news of the day, which is really related to what we're talking about, your last thought on should I go carnivore? Should I go vegan? Should I become a vegetarian? I mean, I get this question quite a bit in the office. So what are your thoughts on that? There's people who go all carnivore diet. I mean, some of my gut patients have done incredibly well with that. So we usually do some base testing as well. But what are your thoughts on that? Like that all carnivore diet?
Yeah. So you're saying people are not taking in any plant products at all?
No, sir.
Okay. All right. I don't know. Maybe because I'm Italian. I am. Certainly partial to the Mediterranean type diet, which is a lot of fresh vegetables and fresh fruit, and lower on the meat, and lower, fresh fish. I think there's a lot of evidence that the Mediterranean diet is a very heart healthy diet. To be honest, I haven't seen the evidence on the all carnivore diet in terms of heart health. Certainly, I think that an all carnivore diet, as you said, could be very healing for the gut and that kind of thing. So it certainly has its uses there. I'm just not sure over the long term how it would be. Certainly, I know that diets, if you're all carnivore and you're not taking in, if you're not taking in carbohydrates and that kind of thing, I guess that would, take care of a lot of the carbohydrates that people would be taking in. Certainly, I guess there are groups like the Eskimos who eat a lot of I assume, whale and seal and that kind of thing.
Yeah.
High fat. I don't really know those statistics. So now I'm going to have to look that up, and I can see what people see what the evidence is out there about those kind of diets and heart health.
So let's jump on to today's current events. I mean, we'd be remiss not to talk about COVID-19, and it seems like those who are at risk, aside from elderly, are those who have cardiovascular risk, those who have diabetes. We can talk about this underlying inflammation. So from your perspective, somebody reads the news and they say, oh my God, I do have a heart condition. And they're now worried. So how do they begin? What is your suggestion for the first thing for them to start? It's like, I got to get heart healthy.
Yeah, I mean, well, the first thing to do is to, do your best to avoid getting exposed to COVID-19, obviously. But I think that, people, and this is what we've been suggesting to our patients, that they should get healthier. They should do all the lifestyle things that need to be done that they may have been putting off. They should be, sleeping more, getting better rest. They should, while maintaining social distancing, should be doing activity to keep their bodies moving. They should, be eating a good, clean diet, avoiding the sugars and the carbohydrates. And then, if they have a heart condition, then, there are usually supplements that we recommend that can help improve heart health. Making sure that they have adequate vitamin D, making sure that they have a heart condition, that they're taking some fish oil. I usually recommend fish oil for my patients, good quality fish oil, certain antioxidants, quercetin, curcumin, those kind of things, lycopene, to optimize the anti-inflammatory and antioxidant capacity of their body to deal with things in case something does happen. I mean, I saw a report yesterday as I was scanning through that COVID-19 itself can cause some heart injuries. So in a certain minority of people, so probably explains why people with cardiovascular disease are at higher risk. So getting yourself as healthy as possible, doing all the things you need to do, I think minimizes that risk for people.
Right. And it's not too late, right? I mean, it's not, you can start anytime. Now would be a great time to start. It's interesting. We find ourselves doing stuff that, we tell our patients to do that by default, it's happening. Myself, I'm sleeping more than I usually sleep. I don't know if that's happening on your end or not. But sleep is really important. So could you talk briefly regarding sleep and cardiovascular health and your take on melatonin?
So, so sleep is very important for cardiovascular health. It is when we are sleeping that we get truly parasympathetic. Our body goes into healing mode, helps calm down inflammation, that kind of thing. And there certainly are a slew of scientific studies that people sleep less than 6 hours a day, that is not good for your longevity. So I would recommend that people certainly sleep more than 6, and I usually try to tell people sleep 7 to 8 hours a night, for best effects. So I want to take on melatonin. So melatonin has many properties. Certainly for some people, it helps them sleep. It also helps actually with acid reflux. And it also works as an antioxidant and an anti-cortisol. So I think melatonin can be helpful for people, especially with sleep problems, but also people who might want to, might have some insulin resistance, cortisol, that kind of thing can also be helpful there.
Excellent. And we have another question. Can exercise slow down atherosclerosis? What is your opinion on that?
Can exercise slow down atherosclerosis? It certainly can. Certainly one of the recommended interventions. Helps, when you exercise, you generate many anti-inflammatory compounds. So that's one way it does it. The other way it does it is, especially in people with cardiometabolic syndrome, is that it improves insulin sensitivity. It actually takes glucose right out of the bloodstream and into the muscles without the need for insulin. So helps control blood sugar in that way. So it has many beneficial effects in terms of atherosclerosis.
Excellent. So in winding up, what last tips, recommendations would you give that person to improve their optimum health, to improve their cardiovascular health, to keep them, as safe as they can from COVID-19, and how to move forward?
Okay. So again, while maintaining all appropriate social distancing, being active, sleeping well, eating a good diet. In my mind, that's a high phytonutrient diet, minimal amounts of red meat, high fish. Let's see, what else have I been doing to help people? Irrigating with hypertonic saline. There's something we came across an article that hypertonic saline, nasal irrigation, the chloride in there actually helps your own cells make its own endogenous hypochlorous acid, which is the active ingredient in bleach. And it has been shown to be active against coronaviruses. There's a study from last year. It was active against a coronavirus that caused the flu. It wasn't tested against COVID-19 because that wasn't known about then.
Right.
So couldn't be tested against that, but it has a broad antiviral activity. So I can share that with you later, Michael. And you can
that would be great. So you're saying this is a preventative measure?
This is a preventative measure. Yep.
Interesting. If you could share, that'd be great, because I like to share it with the people on Facebook and stuff like that.
Yeah. Yep. I've started using hypertonic saline before I go out of the house. When I come back, there are studies that it actually showed that it shortened durations of people's colds and that kind of thing. So the idea is hopefully that it'll, even if it doesn't totally prevent it, that it will knock down the numbers of coronavirus and, make it a less severe case. So
interesting. That's a great share. Thank you for that.
Yeah. You're welcome. Yeah. Thanks for letting me think of all my tips. Let's see.
Yeah, that's really good. What about zinc? Let's talk. I was reading about zinc, like, if you're going to do like a zinc lozenge, to actually like lay on your back and let it just slowly dissolve. I think Chris Kress was talking about to get into the pharynx and all that. I use zinc. Do you use zinc as well?
Yeah, zinc is one of the ones we recommend for people. Absolutely.
Excellent.
Yeah.
Excellent. And do you find that there's one zinc you like better than another zinc? Because I know there's always a conversation of absorption, one zinc better than the other zinc, copper, all that kind of stuff.
Yeah, I'm not sure. I tend to use more of a chelated zinc, but I'm not 100% sure that that's the right thing. It seems like the right thing.
It seems like the right thing. I mean, I take it, so I mean, I use it. So far, so good. Fingers crossed, right? And of course now vitamin SD, vitamin social distance, right? So that's where we're at. Okay. Well, very cool. I thank you so much for your time today. I really enjoyed it. Learned some great tidbits. I hope everybody else did as well. If you can share that link, I'm going to share it with everybody else. And any parting words?
No, just everyone stay safe, be healthy, and thank you for tuning in today. Enjoyed talking with you, Michael, and to the folks who are listening. So let's do this again sometime.
Great. Thanks. We will see you soon.
Okay. All right. Take care, Michael. Thank you so much.
Thank you.